Hi, good afternoon. My name is Asia Higgins-Nino, and for the class of Microbiology, I will be doing a presentation on Mycobacterium tuberculosis, which was case study B. So, the case study. A patient arrives at the hospital with a cough that has lasted for 2 weeks, a fever, chest pains, fatigue, and blood in their sputum. A TB test was performed, and after the gram, acid fast, and endospore stains were performed, the results below were seen. The results. The gram stain was positive, the acid fast stain was positive, and the spore stain was negative. These results concluded that the bacterium infecting the patient is Mycobacterium tuberculosis. The illness contracted was TB, or tuberculosis, and that is an image of it on the lungs. Symptoms. A bad cough that lasts 3 weeks or longer. Pain in the chest occurs mainly while you're breathing, usually. Coughing up blood or sputum, which is mucus from deep inside the lungs. Weakness or fatigue. Fever and chills. No appetite or weight loss. What is it? Portal of entry is the respiratory tract. Pathogens suspended in respiratory droplets are easily inhaled, which is why it's the lungs. It is a serious infection, bacterial disease that mainly affects the lungs, and usually it is serious. So it is transported from an infected person by airborne respiratory droplets when they cough or sneeze, transmitted through air, not by surface contact. Okay. Treatment. Patients with active symptoms will require a long course of treatment involving multiple antibiotics. The vaccine is not widely used in the United States, but it is often given to infants and small children in other countries where TB is common. Some antibiotics mainly was rifampicin, which was the most common. Some others that popped up were ethambutol, pyrazinamide, or isoniazid. The vaccine is bacillus-calmette-guerin, or BCG. And that is just a picture of antibiotics and vaccine. Diagnostic testing. So there's two main tests, the skin test and the blood test. An example of the skin test would be the Mantoux test. An example of the blood test would be the quantiferon. There's another thing that popped up for testing, which is photofluorography. The technique is for mass screening for tuberculosis using a miniature photograph of the screen of an X-ray, fluoroscopy of the thorax. This is an example of the skin test. I personally have had the skin test for my job. I am a CNA, so at the nursing home it was required. And it's just the needle and side effects if there's a bubble in your skin. So that's the example. That's an example of the blood test, and that is the fluoroscopy of the thorax. Habitat. The natural habitats of the environmental mycobacteria are soil, bogs, surface water, groundwater, and seawater. The artificial habitats, such as tap water and sewage sludge, are colonized by a considerable spectrum of mycobacterial species. So that is an example of the bogs. And this is a great example for groundwater and surface water. So, why is it medically relevant? So, there we go. Tuberculosis remains one of today's global health challenges, ranking as the second leading infectious cause of death and one of the most burden-inflicting diseases in the world. The discovery of new markers for high and low-risk individuals in terms of development of TB and adequacy of treatment would allow evidence-based determination of who to treat, how to treat, and how long to treat, both for prevention and cure. COVID-19 has taken a serious toll in 2020 and affects the respiratory tract as well. Both COVID-19 and TB have the same symptoms, although both biological agents transmit mainly via close contact. The incubation period from exposure to disease in TB is longer, often with a slow onset. So that's the only difference. Interesting facts. A total of 1.5 million people died from TB in 2018, including 251,000 people with HIV. Worldwide, TB is one of the top 10 causes of death and the leading cause from a single infectious agent, above HIV and AIDS. Child and adolescent TB is often overlooked by health providers and can be difficult to diagnose and treat. And then the last fact is the TB treatment saved about 58 million lives globally between 2000 and 2018, but important diagnostic and treatment gaps persist. The treatment success rate for people with TB is 85% in 2017. So that is my presentation on mycobacterial tuberculosis, and I hope you enjoyed it. Thank you.